Welcome everybody to another episode of Business Talk. And as you know, we are getting out of the difficulties of what's going on with COVID-19, but we're still doing these interviews via Zoom, just with different local businesses. And today we have Dr. Yazdi from Shepherd Dental. Welcome, Doctor, and thank you for being here.
Thank you. Thank you for having me.
Great, great. So as you know, we want to bring you a little bit of information of what's going on, as well as some value of what each business owner can bring to the community.
Sure.
And like I mentioned, we are here with Dr. Yazdi, and we just kind of wanted to see her experience, see how things are in her office, and see how things are going. So first question, how are you doing?
We're doing great considering the circumstances and how everything has changed overnight. I mean, the whole world has changed, but other than that, we're doing fine. Yeah.
That's great. That's great. That's a good thing. Everybody's staying safe, keeping their distance and the social distance.
We're more than prepared for everything that we have to do to see our patients. So, yeah.
Awesome. So I know that now you are basically back up and running. It's been, I don't know how long it's been for your office. Can you tell us a little bit more about that?
Yes, we have been able to do elective dentistry from April 1st. However, we are seeing patients at 25% of our capacity, which means we're seeing a lot less patients during the day. And also, we basically don't want anybody to sit in the waiting room. We usually have them in the car. If there's one person in the waiting room, then the rest of the patients, they wait in the car, then we call them and they come in. We require everyone to have a mask. We have to make sure they're not sick. They haven't been in contact with anybody who has been sick. Once they come in, we'll get their temperature, make sure that they don't have a fever, and then we proceed with everything else. So there are big differences. We are open for elective dentistry and everything that needs to happen, but there are major changes right now.
Absolutely, and it's a little bit more time consuming now that you have to go.
It's very much more time consuming because my staff and we need to gear up. We have to wear the N95 and the shields and everything, and then everything needs to be changed. And so, yes, it is time consuming. Yes.
Okay, and but you're taking patients, all kinds of patients.
Yes.
Kids, adults.
Yes.
Seniors, all that. Okay.
We actually rather not see patients that have medical problems for their own sake, usually. That was the guideline of Texas State Board, that try not to see patients that have some kind of medical problem that can be affected by exposure with COVID-19, obviously for their own sake. So other than that, yes, we're seeing everyone.
Good. Yeah, and it's not a selective decision. It's a decision that's by the state.
It's a safety decision, yes, based on the health. We want to make sure that everyone stays healthy. Yeah.
Good. So, tell us how if somebody is in that situation or they can't come see you, do you have any tips that they can take before?
Yes, I mean, of course we we'll try. If the patients can come in, then if there's an emergency, we can call in prescription or, guide them through it. Or there's been times that I have a couple of patients that they were medically compromised and I saw only them in the office with no one else. If I have to do that, then I will do that to minimize their risk. So that's what we do. Yeah.
Okay, good. Yeah. And always it's a good practice to brush your teeth every day, right? And floss.
And floss. Yes, it is. Yes. Nowadays, it's extremely good to brush and floss.
Absolutely. Yeah. So that's a good thing that you're moving forward. You're doing things the right way. You're following procedures for everybody's safety. And how is what are the plans? Are you gonna? How long is this gonna last before you can actually be
Well,
100% business
I'm
as
going to
usual.
be honest with you, Sal. I don't think this corona is not going anywhere for a long time. We're mandated for 4 months to follow this exact procedures, which means that I wear N95, my staff wear N95 and KN95, getting the temperature. But however, my personal opinion is that the virus is with us until we find a vaccine for it. So I think we need to be cautious until there is a solution for it. That's my personal opinion. But as far as mandated, is for 4 months.
Okay.
So we'll see.
Okay, good.
Yeah.
And as far as somebody that wants to get or wants to pay you a visit, what do they do? Do they have to do anything extra steps, or is it just the same? Call in, set an appointment.
Yeah, that's it. And just make sure when they come in, they have a mask on and they're not sick. They don't have a temperature, and the rest of it is pretty much the same.
Okay,
not
good.
different. It might take longer, but that's it.
Right, just like everything else. You go to the store, you take longer now because you got to keep your distance. You got to wait till
exactly
the stores are a little bit more empty and things of that nature.
Yeah,
okay.
For sure.
That's good.
Yeah.
That's good. Well, do you have any advice, any other advice for people? I know that right now what we're a lot of times people think that because we're going 100, well, not 100%, but now we're basically opening
we're fully
the market.
Yes. I do have an advice, and I see it now more, and it kind of scares me because the numbers haven't gone down in Texas. So just because we're all open doesn't mean that the coronavirus has disappeared. People still need to be vigilant. They need to wear their mask properly, wash their hands, be careful, because this is the time that it can get worse. And if it gets worse, then we get shut down again. So my advice to people is keep in mind, just because we're all open doesn't mean that the virus is gone. It is not gone. It is not gone. So be careful.
Yes. Yeah. Take precaution and always, you know, that's a good practice that we were taught since we were kids. Wash your hands. Make sure you don't, you don't contaminate your hands, or don't touch anything that you're not supposed to be, you know, and things of that nature. Make sure you stay away from anything that can be contagious, you know, and that's all we have to do. Well, I appreciate your help. I appreciate everything you're doing, and I know that for the medical staff and the medical industry, it's tough. And
it is
because you know you have to be in front of the patient.
You know? It's tough.
So it's something somewhat of a challenge, and I'm sure it's something that my respects to
Thank you.
Thank you. Okay.
Thank you very much.
Well, like we mentioned, Shepherd Dental is open, ready to take any new patients. You're taking in new patients as well as
yes.
Okay.
Yes, we are.
And they can I'm gonna leave the phone number on the bottom where they can contact you if they want to just for a checkup or anything of that. Okay, good.
Sure.
Good.
Sure. Sounds good.
Well, that sounds good. I appreciate it, Dr. Yazdi. If you have anything else, feel free to tell us.
That's it. Stay safe, everyone.
Absolutely.
Stay safe.
Thank you, and I appreciate everything you've done. And we'll leave your contact information at the bottom, and they can go to their website as well. They can, you know,
great,
know a little bit more about. And I know that you're also very active on Instagram.
Yes. Yes, and the Instagram is called Shepherd Dental. So, yes.
Awesome. All right. Thank you.
Thank you.